Well, I'm going to go ahead and get started. I hope everybody's doing well tonight. And thank you for showing up for Therapy Ed's instructional hour. We like to call these online office hours. And my name's Vince Lepak. I'll be the instructor tonight. And I'm going to talk to you about thermal modalities. I'll just tell you a little bit about myself. I'm a physical therapist and I'm a certified wound specialist. I also have my master's in public health. It's not up there. And I'm a certified edema specialist through the oncology section of the APTA and a fellow in the American Academy of Wound Care Specialists. I used to teach thermal modalities a long time ago, and so I'm going to talk to you about this topic today. I'll try to make sure that I look at the chat if for some reason I'm missing something and I don't see somebody in the chat, please let me know. And if there's somebody waiting in the waiting room that you know that got knocked out, please let me know, and I'll try to get to those individuals. So I'm going to go ahead and get started with thermal modalities. So one of the things about therapeutic modalities, just in general, it's a small part of the exam. But of course, you want to get the small parts right. And so if we can be prepared on every little piece of it, then we have a much better chance of getting that ultimate passing score. So therapeutic modalities, you expect about 4 to 6 questions. Now, with therapeutic modalities, a couple things that are important. Things that are critical for PT work activities are biofeedback, hydrotherapy, electrical stimulation. That's covered in another online office hour. And thermal modalities and ultrasound and mechanical modalities. Tonight, we're going to just stay focused on thermal modalities and ultrasound. There are other areas that have been deemed not critical to PT work activities, and that's dry needling, hyperbaric, contrast, light therapy, diathermy, flutotherapy, paraffin. All right. Although you could see screening for appropriateness is still a potential, and then shockwave therapy. So it's important to know what to expect and what not to expect in terms of the NPTE. I'm going to start out tonight with the question, and I'm going to just have you think about it for a minute, read it, and then come up with, and then we'll talk about the answer. And what I'll do is we'll talk about keywords that are in the question and maybe ways to solve the question. So let's get started with the question. And I'll begin to talk about this one. And a couple things about this. One, they've definitely got some swelling, and a cold compression unit is going to be used and sent home. So prior to discharge, the most important procedure for the client to understand regarding the use of this modality, well, all of them are actually important, aren't they? Right? It's important uh, that they apply a stockinette. It's important that they elevate the limb during treatment. It's important that they set the temperature, and it's important that they only apply it for a certain period of time. So the question is, it always comes down to which is most important. And really, the most important thing is going to be the temperature. And that's usually what you think about, okay? It's setting the temperature. So this is an example of patient instructions and what's critical in terms of giving that with some type of thermal modality. So why is it important? Well, this is a case example of where somebody came in, they had surgery. So this was a 53-year-old man who was referred for microsurgery. after a bilateral tendon repair. And the patient had sustained patella tendon ruptures after a fall at his home. He underwent kind of that standard patella tendon repair. Um, and he had no, and the problem was he had no operative complications. So post-operatively, he was admitted for 3 days, during which he had continuous cryotherapy with ice packs and circulating cold waters from an ice cooler. There was minimal padding, and in this case, the device was used continuously. So it's important that all of these procedures are followed. One, that the inspection, that the area was clear, potential hazards, use of stocking net, got to elevate, temperatures must be set right, and then a cooling should be applied, uh, not for prolonged periods of time. So really what you want to do is only apply it for about 15 minutes every couple hours. And then always inspect afterwards. It seems simple, but I've done legal cases before and been with chart reviews. And one of the things I used to see was that some of the therapists would get sued over the inappropriate use of hot packs or other modalities. And that's because they didn't give good instructions or at least document those instructions. So as you can tell, one of the things that happened is he ended up with some full thickness necrosis. They had to have debridement and then had to have a graft. And this could have been avoided, and that's why this is important to the exam. So, a couple things. Always, as you're going through anything that you do, you should understand those physiological effects. And we know that one of the things that happens with heat, it increases metabolism, and that's great, right? You increase oxygen consumption, increase phagocytosis, um, and then enzymatic rates do increase, but they begin to decrease when you get to too high of temperatures. So usually above 113 degrees Fahrenheit, you begin to see a decrease in that enzymatic rate. So what does that mean? A little bit is good. Too much doesn't work. As we know, heat is really good for superficial kind of arterial dilation, but that's not going to increase the underlying flow to the muscles. So if you really want to increase the flow to the deeper muscles, then what you really need to kind of look at is to try to do some exercise. And of course, we know that cold, and as on the right-hand side, you're going to see a decrease in metabolic rate. But you're also going to see an increase in the oxygen, the hemoglobin oxygen affinity rate. And so that's why when you take off like a cold pack, the skin looks red. All right. That's thought to be the reason why that skin looks red. And no matter what, if you are using a hot pack, you should be, or a cold pack, any type of thermotherapy, you should always be checking sensation in that area and then looking at it afterwards. Now, heat also has some vascular effects. We know that it increases nutrients and leukocytes to that area. You have increased rate of clearing metabolites, increased capillary permeability, and you can decrease pain and muscle spasm. Of course, we always have to be cautious when we're applying something. And on the exam, you're going to see a lot more questions than you're used to that deal with precautions and contraindications and potential ill effects from something that you apply. Because one of the things about heat is it can, of course, cause edema and bleeding. And those metabolic demands may not be adequately met if there's inadequate circulation, which is always why it's important to check peripheral pulses and see if the skin is blanching along that. So let's look at the next question. We'll begin to talk about this in just a second, making sure everybody gets let in the room. Okay. So you've got a physical therapist is examining if an AFO could improve the gait of somebody with spasticity due to the gastroc complex. The spasticity is preventing proper application of the AFO. The best method to temporarily reduce spasticity, allowing proper application of the AFO. Well, you've got a hot pack for 15 minutes. Again, we usually think about those as superficial, and then you have to ask yourself, does that decrease spasticity? Ice packs, we know, decrease nerve conduction velocity, and it can go deep. And then if you're trying to get the whole uh, gastroc complex, ultrasound is really not a good method because you can only effectively heat an area 2 to 3 times the size of the effective radiating area, or we might think about that as the ultrasound. So that wouldn't get the whole calf unless you had a huge ultrasound. And then you've got vapocoolant spray is not going to go deep. So the correct answer, of course, is ice packs to the calf for 20 minutes. So again, knowing what might affect nerve conduction velocity and what might be used, depending on the case, is important for this exam. So a couple things. When we think about, we've talked about kind of metabolic and we've talked about vascular effects. And now we're going to talk about neuromuscular effects. So, of course, heat is good for decreasing pain, general relaxation, decreasing skin impedance, and decreasing muscle spasm. But we weren't talking about muscle spasm. So we were talking about spasticity, and it has no effect on it. Plus, it's if you're trying to get deep, it's probably not the best modality. It can affect even strength. So you can see a slight decrease in strength initially. And then after removing it, you can see the strength gradually increases over 2 hours to a pre-treatment level. So it's not going to increase strength or endurance. Now, cold, we know decreases pain and increasing in part by increasing the pain threshold. We also know that it decreases nerve conduction velocity, and that would be really good for spasticity. All right. So it doesn't take that long, but spasms and spasticity are reduced temporarily. So again, it's not a permanent fix, but it is a way to temporarily decrease it. It can alter proprioception. It can also alter muscle strength. So a brief application of cold can actually cause a brief increase in that isometric strength. But again, like anything else, if you apply it too long, you're going to see decrease in that physiological value that it caused. All right, well, let's try another thermal modality. Unless there are questions about that, I don't see anything in the chat. I do see some people saying, "Yep, we did start at 7." All right, and and we are recording this if you did miss anything, and so that'll be published out there. All right, or if you want to hang around and we finish early, I'm always happy to talk about that. So sorry if we couldn't get you quite in. And let's see, just making sure I'm not missing anybody in the chat there. Okay. All right. Okay, well, let's look at the next question. Okay, I'll start to talk about this one. And so you got a PT attempting to increase knee extension due to hamstring stiffness, the best method to increase soft tissue extensibility, prevent injury during a static stretch. Well, again, I'll start from the bottom, but vapor coolant spray doesn't go deep. Um, Again, ultrasound, you're not going to be able to get a wide area. Ice packs are going to stiffen the tissue, so this is going to be number one, which likely it looked like many of you chose in this. All right, so we'll go back to this. I saw there was a chat. Yes, we did start at 7 Eastern Standard Time. So we'll talk about the soft tissue, heat increases, and I saw somebody in the chat. Again, we will be recording this and they will publish it afterwards in case you missed something. And if we get done a little bit early, I can always go back over anything anybody missed. So, as we know, heat increases the extensibility of collagen and decreases joint stiffness. So, those are things we know. And cold decreases the extensibility of collagen. So, I always like to think of our muscles and tissues as chewing gum. They stretch a lot better when they're warm, and they don't when they're cold. So the other thing we always need to think about in the application of a thermal modality are contraindications and precautions. And so these are just standard precautions, whether it's acute injury or inflammation, there's potential for hemorrhaging, thrombophlebitis, impaired sensation, mentation, malignancy, and of course, you should never irradiate the eyes. Pregnancy is a precaution. Basically, you just don't want to put thermal modalities over the child, all right? Where the child might be influenced by those thermal modalities. If there's poor circulation, you have to monitor a little bit closer, judge if it's appropriate. Of course, edema is not something you usually do. Cardiac insufficiency, metal in the area since it conducts very well. You wouldn't usually put it over an open wound. There is what's called normotherapy, where you have normal temperatures, and there's devices that do that for wounds, but they're not elevated temperatures. And of course, if you just had a topical agent applied, it's probably not very good. And as we know, the young and the old, their skins are thinner and they have less ability to dissipate heat. Now, with cold, there's a couple things you always have to think about and in their history. So you might be applying a thermomodality, and maybe the questions about which of these in their history would be a contraindication. And you should be able to pick up on things like a vascular disease, like Raynaud's phenomenon, cold hypersensitivity, cold intolerance, cryoglobulinemia. All right, so it's a rare conditions, but what happens is your proteins aggregate when it's cold. And there's paroxysmal cold, cryoglobulinemia, and again, hemoglobin is released from red blood cells after the cold and the blood. And so what they tend to notice is blood in the urine. You wouldn't put it over a regenerating nerve or over areas of compromised circulation. Precautions include if there's a superficial branch of the nerve, open wound, because that decreases the wound's metabolism and will slow its rate of healing. Uncontrolled hypertension, poor sensation or mentation, and very old or very young. And so that brings us to the questions you should always be asking, especially with cold safety. Like, do you have any unusual responses to cold? Do you develop a rash when it's cold? Do you have severe pain, numbness, color, changes in your fingers when it's cold? Do you get blood in your urine? So part of the history might be asking about appropriate questions to see if a thermal modality like cold is appropriate. Of course, in Therapy Ed, we have our review and study guide, and we go through some very nice things. We have a chapter devoted to modalities, and part of that deals with thermal modalities. So in there, we've got the physiological responses that you would expect to cold, whether it's blood flow, capillary permeability, elasticity, metabolism, muscle strength, muscle spasm, spasticity, and vasoactive agents. So we have that in there, and it's important to understand the mechanism of what systems are affected. The other thing that's important to understand is, again, those systems, whether it's what happens with the joint, pain threshold, increased blood viscosity, and muscle strength. So it's really nice, I think, that we have that built into our review and study guide. So that's just a short time on thermal modalities. I don't know, were there any questions over that?
Yeah, I had a question. Are you able to hear
Sure.
me?
Yep, I can.
What is the name of the diagnosis when you have blood in urine when it's cold specifically?
Yeah, so that is going to be the paroxysmal cold cryoglobulinemia.
Thanks.
Yeah, great question. Can you see it up there on the slide?
Yep.
Yeah, perfect. Now, I may be butchering the way that you're supposed to say cryoglobulinuria, but that's okay. The exam's not going to question you about how you pronounce things. Any other questions? Okay, well, let's talk a little bit about ultrasound then, because that's a pretty common modality that's used out there. And let's go ahead and look at a question. Again, I'll give you a little bit of time to solve it. Welcome to you, those who are just joining us. We're about halfway through the presentation, but we are recording it. It will be published online later. All right, well, let's begin to talk about this. And a physical therapist is evaluating this 25-year-old person with acute tendon strain of the extensor digitorum of the hand. Therapist likes to use ultrasound to help modify their pain and influence the current stage of healing. Which of the following parameters would be best to use? So this is acute. Usually with acute, we do not want thermal. Right? So with acute, we typically don't want thermal. And that means using a pulsed. Now, these structures are shallow, so we should use a 3 megahertz. So we should use a 3 megahertz. So a couple things. When you look at 3 and 4, those are going to be, of course, for continuous and designed to get a thermal. But what we're trying to do is look at something acute. And so that means we're going to try to reduce or influence that inflammatory state. And typically you don't want heat. So a couple things about ultrasound. And you want to use a low intensity too during that time. So you want to use a low intensity. So a couple things. Um, as we know, ultrasound, one of the things that happens with it is you get attenuation of those waves. And in other words, some of the waves are transmitted, some are refracted, and some are reflected. And so when you're using ultrasound, 3 megahertz doesn't penetrate very deep. So it only penetrates 1 to 2 centimeters, but that's great. All right. If you've got something 1 to 2 centimeters deep, if you've got something much deeper, then you're going to have to use 1 megahertz. And again, there's different types. There's continuous, there's pulsed. The pulse duty cycle is usually set at 20% because that's what a lot of the research has been done on. There might be better duty cycles, but that's what we know has worked in some of the research studies. So a couple things. We should understand the thermal and non-thermal effects when we're using something. And so with the thermal effects, you have elevated tissue temperatures. That's great. And of course, 1 megahertz can do that, all right, as well as 3 megahertz, but it depends on the depth. And you need to use sufficient thermal properties or enough intensity to get heat. And again, you need to do an area 5 to 10 minutes, 2 to 3 times the size of the effective radiating area. Some textbooks say 2, some say 2 to 3, right? But you really need to increase that temperature up to about 104 degrees Fahrenheit or 40 degrees Celsius to have a good physiological effect. And we know that there is a direct relationship between intensity and the increase in tissue temperature. So you're going to get, twice as much heating with 2 watts per centimeter squared versus 1 watt per centimeter squared. And we know that one of the things that you don't have to do is turn up the intensity as high with 3 megahertz because it heats 3 to 4 times as fast as 1 megahertz. Now, the other thing it does is it increases collagen extensibility. It'll increase blood flow. It also changes nerve conduction velocity. So one of the things that ultrasound does is it heats collagenous tissues. So it'll heat that collagen tissue, and it can actually alter or even block impulse conduction. It can increase membrane permeability and also increase tissue metabolism. It can increase the pain threshold, in other words, making it harder to cause the pain, and it can increase local metabolism. Some non-thermal effects, and remember, non-thermal effects happens with continuous ultrasound. What you don't get are the thermal effects with a pulsed ultrasound with a duty cycle of 20%. But we know it increases membrane permeability, and this can alter ion diffusion. It can increase the rate of protein synthesis, all right, and it can increase macrophage responsiveness. And just like we talked about with the other thermal modalities, you've got to know the indications and contraindications. Usually, when is it used? It's used with contractures, all right, pain control, dermal ulcers. Now, you wouldn't use thermal with the dermal ulcers. What's used is more the pulsed 20% with that. Skin incisions would be the same way. Tendon and ligament injuries, fractures, all right, carpal tunnel syndrome. Contraindications, malignancy, pregnancy, central nervous system tissue, you don't usually like to heat, joint cement, plastics, pacemaker, thrombophlebitis, eyes, and reproductive organs. Precautions are acute inflammation for heat, epiphyseal plates, all right? So that's a precaution. It shouldn't cause the plates to close. That used to be a contraindications, but it's ruled more of a precautions. Again, over fractures and breast implants. So this is kind of nice. This is out of Michelle Cameron's textbook, From Research to Practice. And so I like this. It's pretty good. She talks about soft tissue shortening, use thermal. And so that means it's a continuous 100% duty cycle. If the depth of the problem is shallow, then you use 3 megahertz. If it's greater than that, or if it's, 2 to 5, then you want to use 1 megahertz. And then you don't need to use as high as intensity to get a thermal effect with 3 megahertz because it heats 3 to 4 times the rate of 1 megahertz. And you need to use a higher intensity with the 1 megahertz because you only get half of the intensity at half of the depth of penetration. And so what that means is, let's say the soft tissue shortening is the skin surface, and you're applying 2 watts per centimeter squared. And then the depth of the problem is half of the depth that 1 megahertz can penetrate. So at half of the depth, you're getting 1 watt per centimeter squared. And then all the way down here, okay, at ultrasound intensity is that, we'll say that depth is 5 centimeters. So that means you're only getting a half a watt per centimeter squared. So at the surface, you started out at 2, half of the way down, now you're at 1 watt per centimeter squared. And then at the 5 centimeter depth, you're at a half a watt per centimeter squared. And then the other reason to use it is with delayed tissue healing, in other words, wound care, or prolonged inflammation, or with an inflammatory state. And in those periods, you want to use non-thermal. And then the choice for the megahertz is still the same. So the choice for the megahertz is still the same, but you just want to use a smaller in ultrasound intensity. Check the chat. So one of the questions was, what frequency intensity would you use for 3 to 4 centimeters deep? Yeah, so I would use the 1 megahertz because the 3 megahertz is not going to be helpful. There is a 2 megahertz. I just don't see them asking you that on the exam, though. There's a 3.3, there's a 3 megahertz. It depends on the company and the machine. So you ask a great question. But if you got 2 choices, 1 megahertz or 3 megahertz, and it's 3 to 4 centimeters deep, you're going to choose 1 megahertz. Because 3 megahertz only does 1 to 2 centimeters deep. Great question, though. Okay, let's try this question. Okay, I'll start to read this one. So you've got this 25-year-old soccer player, his 1 week size post cast removal, distal radial fracture that required an ORIF. Wrist extension is limited to 75 of contralateral sinus or a firm capsular infield. The therapist is considering ultrasound as part of the overall management. In this case, the best parameters to select are. So this kind of becomes a little bit tough in terms of, well, do I use 1 megahertz or 3 megahertz? But let's look at a few other things. You definitely want thermal in this case. Or I didn't talk about number 4, ultrasound is contraindicated. So ultrasound is not contraindicated in this case, and I'll talk about that. So ultrasound is, you can use that. I'm just going to look at the messages here. Okay. And pulsed is non-thermal, so we really need to focus on 1 and 2. So a couple things. One of the things about ultrasound, you're only supposed to use it for 5 to 10 minutes in an area 2 to 3 times the size of the ERA. So that's going to eliminate number 1 right away. So if you're wondering about depth and other things like that, one, the time is just not correct. All right. So that helps you out with that. And the correct answer is going to be two because, well, the joint capsule for the wrist is not that deep. All right. So the joint capsule is not that deep. And it's an appropriate intensity. You don't need a high intensity with 3 megahertz. You need somewhere between 0.5 and 1 watt per centimeter squared when you're trying to do a thermal. So one of the things about questions and their options, all of the components have to be correct. So if you see a component that you know is not correct, then that can be a pretty good deal. Thoughts or questions on that one? So sometimes I know that people are like, well, wait a second. I thought, they had surgery and maybe that's a contraindication. All right. But look, it's only the cement or plastic components are contraindicated with ultrasound. Right. It actually, ultrasound can be used over areas with metal implant screws and all other metal joint replacements because ultrasound doesn't really heat the metal and it doesn't loosen screws. And we've known this for quite some time. But what happens is people are like, oh, I shouldn't use it around metal. And what they're really thinking about is the cement or the plastic components.
Can you explain why we want some sort of thermal reaction? Is it because there's some limitation in, well, actually, I'll just let you explain.
No, you're right on track. There is some limitation, and it's a firm capsular infill, so the wrist extension is limited. And that's a great time to come in and use ultrasound because ultrasound is really good at heating up collagen tissues like the capsule, and that will increase the extensibility, which will then allow your mobilization to maybe work a little bit better, or the stretch maybe to work a little bit better. Now, some people
Okay.
may not choose to use ultrasound. That's okay. But the question asks you to use ultrasound. Does that help?
Yes, it does. Thank you.
Yeah. And just in case, and let's do the mobilization now. Does anybody know which direction that you would mobilize the proximal row of carpals? Would it be in a volar, palmar direction, or would it be in a dorsal direction? So this is convex moving on concave. So that means the roll and glide are in opposite directions. So that means you would do a palmar glide of the proximal row of carpals to encourage wrist extension because roll and glide are in opposite directions. So with thermal modalities, we are, we've always got to know the indications and contraindications. And so we do talk about them in our textbook. So we talk about cryotherapy, thermotherapy, hydrotherapy, ultrasound, and then we go into other modalities. So it's important that you know the indications, precautions, and contraindications for the typical modalities. The great news is that there's very few questions related to modalities anymore. So it's not a big topic. Of course, this is that's what I had for you tonight, but I'm happy to kind of answer any questions that you might have. And I'm
Yeah,
also,
this
for
is,
those of you who kind of missed the start, I'm happy to kind of go back through the first part.
I have a basic kind of question.
Yeah,
Could you explain why fewer megahertz go deeper than more megahertz?
I can. Yes. Let me just make sure. Okay. Let me see. I'm going to go back just a second. Sorry, I've got one screen and, or one computer screen and many screens up. So it takes me a minute to flip back. So I'm going to go to, I think this. Okay. So you can see the slide that says attenuation. And so
Yes.
one of the things, let me get to different viewpoint for myself because I'm going to draw on this a little bit. Let's see. And are you able to see the red mark that I made?
Yep.
Okay, perfect, perfect. So we're going to say this is the skin surface, okay? And so what happens is that you have all these little molecules in here. Okay, now this may not be the perfect explanation, but this is part of it, okay? And so you have all these cells and you have all these cells in here. That's what I'm trying to draw. And when the ultrasound hits it, it causes them to vibrate back and forth. Okay, so all these little molecules and cells are vibrating back and forth. So it causes those structures to vibrate back and forth. In part, it's my understanding that that increased vibration also then begins to block those waves. And you might think about it like sunlight. What travels farther? Well, it's the longer wavelength. All right, so it's the longer wavelength. And so that's the same thing in ultrasound. So when you're talking about an ultrasound wave, the 1 megahertz, there's going to be 1 million waves within that second. In this 3.3, in this example, there's going to be 3.3 million. So they're going to be much shorter in terms of their length. And so the longer the wavelength, the farther the sound travels. Like a stereo system, bass travels much farther than a high frequency sound. Does that help?
Yeah, that makes a ton of sense. Thank you.
Yeah. Maybe going with speakers.
Seth, could I offer a memory tool for this concept that ever since I heard about it, it helped
Sure.
me remember it.
That'd be great.
Yeah, it'd be great.
So, and this is what the teacher told us as students. The 1 is kind of like a thin arrow. And so it goes deeper like a thin arrow. And then the 3 megahertz is round and can't get very deep because it's round and bouncy, essentially. And so just like
Nice, I
that
love that.
visual
That's
aspect
good.
of like
Yeah,
thinking
that's
if
a
the
good
1 goes deep.
visualization. I haven't
Yeah,
heard that
has
one
always
before.
helped me. I know it's funny, but there you go. There you go.
Nice. Yeah, that's great. That's part of it is trying to share things. So, excellent. Somebody asked a question I saw in there about the last question. Get to it real quick. So why are we using ultrasound? Let me get back to the question and read it again. I'm confused on the need for continuous ultrasound as they got out of the cast. Wouldn't they have some level of swelling or inflammation? So, great question. All right. So, when they get out of a cast, you're assuming that everything is healed. That's why they're out of the cast. So, if there was excessive edema or something like that, great. But it doesn't state that they have edema. It doesn't state that there's any inflammation or anything like that. So the fact that they're out of it means that they're healed. And so it's a great point because one thing to be cautious about, if you say what if, then you're probably adding information in. Does that help?
Yeah, it definitely helps. I have a bad habit of adding additional information.
Yeah. So just be careful and yeah. So if you're asking the what if, you're probably adding information. Great.
Could you
And
also
that's
just
pretty common too.
could you also go over the intensity as well? I
Sure.
sometimes get confused on that too.
Let's see, I'm looking. There we go. So intensity. So it depends. If you're trying to do thermal, okay, in 3 megahertz, since it heats 3 to 4 times as fast as 1 megahertz, you don't need to use as high of an intensity to get the thermal production. And so you could use anywhere from 0.5, whoops, to 1 watt. Okay. So the minimal effect that you would need would be 0.5 there. In an area 2 times, this says the size of the ERA, which again is the effective radiating area. And then the intensity with 1 megahertz needs to be higher to get a thermal effect all the way down to the base. Because again, if you apply, this is going to be the skin surface. If I apply 2 at the skin surface, then by the time it gets to half of the distance it's supposed to penetrate, you've only got 1.0 because of all that attenuation. All right, the ultrasound is scattered, been absorbed. And so this would be, and then if you're trying to get down to the full depth at the base, which would be 5 centimeters, all right, you really end up with about 0.5 watts approximately per centimeter squared. It may be more, it may be a little bit less, but it's somewhere around that. So that's really how you choose kind of the intensity.
Okay, so basically the one, like someone pointed out, the thin arrow requires a little bit more intensity to get deep,
That's correct.
whereas the
Yeah,
fat three needs less.
correct.
Okay. Okay, perfect. Sounds good. Thank you.
Yeah, the thin arrow needs a little bit more oomph to go through to go deep, and the fat arrow does not.
Yeah, the thin arrow needs to pull, you need to pull the thin arrow a little bit farther back of the bow.
That's right. That's right.
Okay, thank you.
And then with non-thermal, it's using less than you would use with thermal because you don't want the heat. And remember that with ultrasound, even thermal, you're getting the non-thermal effects. Other
Could you,
questions?
could you quickly talk over the pulse versus continuous for ultrasound, when to choose one or the other?
Sure. Absolutely. Get the screen out of my way. And you're still seeing the decision tree?
Yeah, thank you.
Right, perfect. So basically, if you have an acute inflammation or maybe even subacute, in other words, there's prolonged inflammation, then non-thermal is supposed to be good. If you have delayed tissue healing, in other words, wound healing, then non-thermal is good. So basically kind of acute or maybe even subacute, that's when the non-thermal is recommended. And anytime you've got more of a chronic issue, like chronic pain, um, you've got a contracture or soft tissue shortening, that's when thermal is appropriate.
When do you decide whether you want to use like a pulsed option though? Is there both? Can they both
So
pulsed
the
or
pulsed is the
continuous?
non-thermal.
Okay.
Yep, yep. So the pulsed is the non-thermal, and the continuous is the thermal. And that's where the duty cycle comes in.
Thank
And
you so much.
yeah, and how that's determined is like here's the 20% duty cycle. So you take how long it's on, okay, which would be 2 milliseconds. times the off period, or divided by the on period plus the off period. And that's how you get 20%. So the on period plus the off period would be 10 milliseconds in this. So 2 divided by 10, you get 20%.
And for non-thermal, we always want the duty cycle to be 20%. And then for thermal, we always want the duty cycle to be 100%.
Yes.
Okay.
But if you had a 40% duty cycle, that would still be pulsed. It's just the standard is 20%.
Okay.
So anything, if you had a 50% duty cycle, that means it's going to be on half of the time and off half of the time.
Okay. So basically anything that's not 100% can be considered pulse.
Correct.
Okay.
And of course, the lower the pulse, the less thermal effect, the higher the pulse. They wouldn't give you something like a 90% pulsed duty cycle. I don't even know if there's a machine that can do that. Usually they're kind of set at 20%.
Okay. Thank you.
Mm-hmm.
And
think
did you also? Oh, sorry. Go ahead.
Sorry, yeah, I'm probably gonna just. So I saw the textbook. The textbook say like don't use ultrasound, promote joint healing. But like for the question we just had, like the capsule stiffness, we can use ultrasound for it. Can you explain a little bit why we cannot use ultrasound to promote joint healing?
Yeah, so what do you mean by joint healing?
I think it's just on the textbooks, like the therapy ed textbook, and they just say like don't use ultrasound to promote joint healing or achieve long-term pain relief for musculoskeletal conditions.
Right. So it's not going to help like meniscal repairs and other things like that, or osteoarthritis. And it's a short-term relief, right? And typically, if you've got chronic pain or other things going on, you shouldn't be, modalities are not the primary method of trying to do something like that. So modalities are only going to give you short-term effects. So if you're trying to get long-term effects, that's not usually why you want to choose a modality. So in this question, if you're asking, oops, let me get back to it. Sorry, I went the wrong way. So if you're asking why in this question, was it a choice? And it's because you're trying to increase the extensibility of the soft tissue.
Okay, I see your point. Yeah, that's helpful. Thank you so much.
Yeah. So you're not trying to heal the joint. You're trying to increase the extensibility of the soft tissue. Thanks for bringing up that point, though, because that's a really important concept about modalities.
Thank you.
And did you say before that non-thermal, or I'm sorry, that the thermal effects also produce non-thermal effects, but a non-thermal ultrasound does not produce thermal effects? That makes
You
sense.
got it. You're
Okay.
right on it. Because the
Yeah, thank you.
non-thermal effects are from those molecules vibrating. And so those molecules vibrating are going to increase microcirculation around it. Right? So that's one of the things it does. And it also changes nerve conduction, membrane permeability. And so that vibration is still occurring with the thermal effect. They call it acoustic streaming.
Okay, thank you.
Other questions? Hey, great questions tonight. Really appreciate it.
Real quick clarifying. When talking about the thermal effects and when to use it versus not to use it on metal implants like the ORIF. We're talking about hot packs is not okay, but ultrasound works because it doesn't heat the metal.
Right. Of course, hot packs are not going to penetrate really deep. I was trying to think about it becomes a precaution. With thermotherapy. I don't know if I can blow that up or not. Yeah. So it becomes a precaution with thermotherapy.
Okay, thank you.
Yep. Great question, though.
Hi, I put a question in the chat regarding effective radiating area.
Oh, yeah.
Can you please give us a numbers example of how it would apply during for treatment time?
Sure, I can. Sorry. And you all lost the share screen, right?
Yeah.
Okay, just a second. I'm trying to get it back and it's not giving it back to me. There we go. Let me get back to my presentation. Don't know why it clicked off of that, but it did. So, okay, there we go. All right. So the effective radiating area, let me get to it real quick. So we have something to talk from. Okay, let's get to this slide. So a couple things. So what that means is that a couple examples. So look, if you have a 5 squared centimeter ultrasound head, okay, so that circle represents 5 squared centimeters. Then you would be able to do another area about like that. Okay. And in fact, you know what? I actually have an ultrasound head, and this may make, let me grab it real quick. Okay. Sorry about that. I'm back. It's actually an infrared head, but it makes just as much sense. All right, so this area, if you looks like an ultrasound, it's really not, but it looks like it. This area under here is what's called the effective radiating area. That's the size of the crystal. So there's a crystal in there that when current is applied to it, it vibrates and produces a sound wave. All right. And so usually that is pretty close to the size of the ultrasound head. Close. And so let's say this is 5 squared centimeters. Then you would be able to cover an area twice that size. And it would take 5 to 10 minutes at the intensities to get that area warm sufficiently or to cause the thermal effect. So what that means is you can't do a very big area. So like on my shoulder, I might be able to do, this much area, I'd be able to do the anterior deltoid. Or let me go to the forearm, that's probably better contrast. Then I might be able to do an area twice the size of this ultrasound head. But and it's going to take 5 to 8 minutes to get enough intensity from the ultrasound to sufficiently heat that area. Does that?
Gotcha.
So if you aren't going for the heating effect, does it matter?
It does. It's the same. It's the same. To get good non-thermal effects. Yes, it's the same.
Okay.
That's why you can't do like a big area with ultrasound. So, because my biceps are huge, I'd have to have a huge ultrasound head to cover like that to cover them. Yeah.
Thank you so much.
Yep. Thanks, Rachel. Okay. I don't know. Let's see. Let me look in here. Okay. Well, I hope this was helpful. Any other questions? I know I said I'd go over the first part of it for those people who kind of missed it. So I'd like to do that. We're kind of out of time, but we'll take 10 minutes and we'll go over the first part. So I appreciate it. Those who made it tonight, we had a good crowd, and I hope everybody is safe tonight and they were not, and that your families and friends are safe from, well, the weather that's been happening and is continuing to happen. So I'm going to go ahead and go over just kind of the first part and just kind of go through it. So one of the things to recognize about the therapeutic modalities, it's only going to be 4 to 6 questions. And I'm going to go ahead and stop the recording because we don't need that to go and continue on. Now let me do that. Hold on.